Hey guys, welcome back. I'm here with Dean Kilby again, my health coach on the journey I'm on for weight loss and health. Hey Dean, how are you?
I'm great.
This is good. So we're going to go through and ask or answer some of the questions that I've been asked for the last week since I did the update on my weight and my dimensions and all that sort of stuff, and probably talk about a couple of other things along the way. So first off, welcome Dean. Thanks for being on these calls.
You look slimmer.
I feel slimmer. I said to the other day when I was training out the back yesterday, I nearly jumped through the ceiling when I was doing my squat jumps.
Well, that's good news. It means like your muscle strength is still there, but there's not as much weight weighing them down.
Yeah, exactly right. It's been good. So I've got a question that came up for me in one of the times I was like, should I just, surely I can have one more thing here and, all that sort of thing. And I thought, hang on a sec. Say not with one of the, the part of the meal plan or whatever, but say I just went, sod it, today I'm going to have a beer and cheese, right? And we were talking about, it takes about 3 weeks to, reset your metabolism and your hormone system and all that sort of thing. So say 2.5 weeks in, I go on, smash a pizza and a beer. How is it, like 3 weeks start again, or how long does it take to get back into where I was at that point?
Yeah.
As far as the ketosis.
Yeah, sure. Beer and pizza. It's a universal constant, right? Well, firstly, I mean, if we talk about alcohol, right? So if you're in ketosis, which you have been and you are, what that means is we restricted your carbohydrate intake, you've exhausted your body's own carbohydrate stores. So your body stores glucose. So all the carbs that you eat gets broken down into glucose, and that gets stored in your muscle and your liver in the form of glycogen. So if you restrict the amount of carbohydrates that you're eating, then you will exhaust your own carbohydrate stores in about 3 days. So your body's got two options. It's going to turn to muscle or fat. And we protect the muscle with the nutritional design. And so your body just turns to fat, and it converts the fatty acids into ketones. And these are molecules that the body then uses as a fuel source instead of glucose, right? Yep. So your liver produces the ketones. Now, there are like 3 major tissues that still require some glucose.
Yep.
So as I've said to you before, there's essential fatty acids and essential amino acids, but there's no such thing as an essential carbohydrate, right? So you don't need to eat carbs. What happens in your body's so bloody clever. It can convert amino acids in your liver, and your kidneys will turn them into glucose, just the right amount that your body needs. Right. So the 3 tissues that need glucose are your erythrocytes, that your red blood cells, your adrenal glands, your adrenal medulla, and your certain cells in your brain require glucose. Right. So that process of turning amino acids into glucose is called gluconeogenesis. Right. Gluco, referring to glucose, new, genesis, the creation or bringing forth of. So if you consume alcohol inhibits gluconeogenesis.
Right.
So whilst you're in ketosis and your liver and kidneys are producing enough glucose for your brain, if you drink alcohol and inhibit that, then you don't get enough glucose to your brain.
Right.
And so we call that cerebral brain hypoglycemia. So not enough blood sugar into your brain. So you run the risk of passing out, hitting your head on the corner of a table, something like that, right?
Yeah,
You
wow.
end up in accident and emergency, and they go, Trevor, what have you been doing? Oh, I was doing this diet with Dean, right? And that's so I have a blanket rule when
There's
you're
so many
in the
comments. There's so many comments coming under this under this post. I'm telling you now, I can hear them already.
so and this is why I always send my dieters, my clients, to their GP. It's optional, but I highly recommend it. I'm not a doctor. I don't try to take the place of a doctor. I want to empower the relationship between the health consumer and their primary healthcare practitioner. So I like to get baseline blood work done. And so I know not only what's happening with your biochemistry, but also to strengthen that relationship with, between you and the medical system. And, you just got to understand how to talk to doctors, and I coach people on how to do that, how to have those conversations. And you got to understand the medical system. And if you're already taking medications, for example, a lot of people take drugs to lower their cholesterol or lower their blood pressure, or you might, I know you're not so much experiencing the right, the throat clearing that you were doing, which is a lot of the time due to reflux and allergies and stuff. But the reflux, if people experience reflux or heartburn, which is often the case with obesity, doctors will put them on drugs called proton pump inhibitors, PPIs, and they're one of the highest grossing medications on the planet. When I put dieters on my program, within 7 to 10 days, they stop taking those medications. They just don't need them anymore.
Yeah, right.
But all the other medications, as their health improves, you need a doctor to down titrate the dose or remove the medications. You don't just stop them because you feel better or you think you can. You need to do that in partnership with your healthcare practitioner. So with regards to eating pizza, so carbohydrates and fat, so you said 2.5 weeks into the protocol and you have an indulgence. Okay. So it does a couple of things. One is it does kick you out of ketosis. And then it'll take you, a little bit to get back in. May not, depending on what the indulgence was and how much, it may not take you that long to get back into ketosis.
Right.
But it does waste time. And then you beat yourself up later because you'll feel like crap for doing it.
Well, I was going to say, because I think a lot of people would get to, 2.5 weeks in, they've tried a lot of things already. They already view themselves as not being able to do it in the first place. And then if they're thinking it's 3 weeks in before I even hit ketosis, and it's 2.5 and I've just smashed half a pizza and a beer.
Yeah.
What's the point now? I'm not going to stop. If I can't make 3 weeks, what makes me think I'm going to do it again? That's why I asked, how much, is it just a matter of going, well, that happened, let's get back on it?
Yeah. I mean, what else? You can't, what are you going to do? I'm not going to tell people off. I'm not going to scold them. I'm not their parent, or, they're hard on themselves.
I know you.
I'm a very loving person.
Yeah, you are. You are.
No, but I do. I care. And I don't let people get away with, that kind of behavior. And, that's why that in the beginning, and this is why I don't take on just anyone. Like, you have to be coachable. And we have an agreement that, I promise to work with you to produce the outcome that you're committed to. And you promise to do things the way that they're designed, and be coachable.
Yeah.
And being coachable sometimes means like copping it when you've been a juvenile delinquent and decided, because you felt upset one day, that you were just going to blow everything and have a pizza. Not like, and this happens. Like, I've had, healthcare practitioners that I've coached who said, oh, Dean, I lost it. I deviated. I go, what did you have? They said, pizza. Not like a slice of pizza or even a bite, like
pizza.
a whole pizza. And I said, so you took, like, you had to order it. You had to wait for it. It's not like you just accidentally sneezed and engulfed a pizza on the inhalation after. Like, there was time where you could have just thought, wow, I'm not going to do this. So what does go through your mind? How do you make it okay to be a criminal and not honor your word, right?
Yeah.
So on one hand, it's not good. You want to be vigilant, particularly within the first 3 weeks. On the other hand, if you do deviate, we can start to identify what were the mechanisms, what was that voice in your head saying to you prior to smashing it? What were you saying to yourself as you were eating it and you knew you shouldn't have? And then what were the feelings like afterwards? How did you justify it? And how you explain, and then to what degree are you trying to hide what you did? And these are the behaviors of people who have lacked integrity around their health. And my job as the coach is to work with them so they can have real breakthroughs, real tangible breakthroughs around these mechanisms. So those habitual ways of being and acting no longer have a grip on them. They have these behavioral things of the past that now they can be responsible for. And the more they discover the predictable nature of their own humanity, the more you can be responsible for putting structures in place to support yourself so you don't deviate and you actually just get the result.
Yeah.
You know, you're either going to get the result or you're going to have some really great, valid reason why you didn't get the result, right? You're either going to get committed to the outcome that you want or to the explanation. It's really that black and white. And I don't mind when people deviate because, like I said, that's when you get to discover what it is that trips you up, and we can tear it apart and examine it. It's kind of like when you're training a dog not to bark. The only time you can train a dog not to bark is when it's barking. So when all your stuff comes up, like, I deserve it, you know, this won't hurt, it's just a little bit, I'll exercise it off tomorrow, or whatever you say, that's the dog barking. And then you act consistent with a dog barking in your head, right? And that's the level of maturity that people start to develop. It's like they start to recognize, oh, they're just thoughts, or they're just feelings, or that's just a mental state or an emotional state, or that's just a body sensation. It doesn't mean I have to go eat a pizza or have a beer, or that's just peer pressure. My mates are saying, come on, one won't hurt. And, you know, as you're an adult, you can say no. No one's gonna like think bad. Well, people do think terrible things of you, and you have to accept that, and you think terrible things of them. So get responsible for your own thoughts first before being at the effect of what you think other people might think.
I know for my mates, you know, they probably wouldn't peer pressure me anyway, but if they were and I said, yeah, sod it, the immediate thought is, see, I knew you weren't going to stick to that. You suck.
Exactly. And they'll test you.
Yeah.
Because if you honor your word in the face of everybody else's resignation and cynicism, it's a confronting threat for them. Because, wow, you're really doing it. Then they have to confront, well, I really should be doing something for my health as well. But they're going to make sure that you're not, you know, it's not even their fault. It's just the way human beings work.
Yeah.
You know, and I had one dieter. It was great. And he was a couple. So he and his wife came to me and they wanted to get well because they wanted to start a family. And his wife was type 2 diabetic. And anyway, it was amazing. She reversed her type 2 diabetes and he stopped his snoring within a week and a half. And I mean, it was incredible, right? But then they went back home to India for a couple of months and then they let go and he put weight on and didn't come straight back and get it sorted with me. Anyway, after a little while, he comes back and he goes back on protocol in phase 1 and starts losing the weight really quickly. And it was interesting. I said to him, what do you find is different this time around? And he said, well, it's predictable. I know what's coming. Like the various sensations, it's not like, I'm not worried about it. It's like, oh yeah, there it is. There's that hunger pang, or oh yeah, there's that thought process or whatever. And he said that the other thing was when his friends tempt him now with other food, he doesn't feel the need to explain anything to them, or he just says no.
Yeah.
That's simple.
Yeah. Yeah. So, I was at a mate's place today, and, you know, he's got a coffee machine and he's really proud of the coffees he makes, which is great. You know, and you want a coffee? And I was like, yeah, as long as it's black. Got a lot of water in it. So I don't know how you drink that mud. Just take just get used to it. Just get used to it.
A lot of people are addicted to their coffee, and sometimes it's habitual. Sometimes it's like time that they get to just be with themselves and think, or it's the warmth of the coffee is comforting for them. But a lot of the time it's a reliance on the stimulatory effects of the caffeine. And what you find is when you're on protocol, your energy levels go through the roof, and you don't have the lethargy, and you've got the clarity, the brain fog disappears. And so you're not reliant on the coffee anymore. And then when it's coffee time, or you would normally have it at that time of the day, you're like, actually, I don't even need it. You know, you could do something else.
Yeah.
So the other thing around deviating, particularly in the early weeks, the first 3 weeks, is when you consume those carbohydrates, it stimulates parts of the brain.
Yeah.
I don't know if you've ever seen the positron emission tomography scans of people's brains that light up when they're addicted to something, right? So sugar and carbs, the same parts of the brain that are affected by drug addictions, cocaine, for example. So that lights up, you know. So if you deviate, it's like ding, 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 ding. And you want to think of it like that's going to cause you to want to eat more. So it's never when someone says to me, oh yeah, I screwed up. I gave in and I had a little bit of beer and some pizza. And when I ask how much, oh, just one and just a bit of pizza. If they're not specific, I know that they've consumed an amount that they're embarrassed to say.
Six-pack and a six-pack.
And even when they do say it, human beings are dirty rats, you know, you and I included, but it's kind of like whatever people say when they acknowledge some lack of integrity, it's only ever the tip of the iceberg. You know, it's always 10 times worse. But then,
so
around,
when we're talking about a voice and you know how I'm like, I just don't have the need to clear my throat as much anymore. I still get it every now and again, and it's probably going to get better as time goes as well. What else? You know, that's like a side effect, I suppose, of the losing the weight and all that sort of stuff. What else can people expect other than the weight loss?
Yeah, the protocol is a health and vitality protocol first and foremost. You know, so we're committed to rebalancing your hormones, reducing inflammation, giving your body a chance to heal. So it's difficult for your tissues to regenerate when there's a background context of inflammation. So that's one of the reasons why, you know, you're a pretty fit kind of guy, and yet you had osteoarthritis in your knees. And a lot of people relate osteoarthritis to excessive wear and tear. And yes, that is true. If there's some biomechanical dysfunction or malalignment, you know, from trauma, you've had an accident or something in the past, but the cartilage is always going to wear down because of the movement. That's just things wear. But our cells have an ability to regenerate. And if there's background inflammation, then it just doesn't regenerate properly. So in the case of your cartilage, there's different types of collagen. So, you know, there's some evidence that suggests that your chondrocytes, which are the cells that make the cartilage, in the background context of excessive inflammation or too much inflammation, and I'm talking low-grade chronic inflammation. It's just like it's low, but it's constant. If lays down collagen 10 instead of collagen 2. And collagen 10 degrades faster.
Right.
So the net effect over time is your cartilage
Gets
degenerated, right? To the point where you were heading towards total joint replacement. And we treated that with stem cells and, sorted you out. But that kind of regenerative effect can happen in your pancreas. It can happen in other tissues in your body. So long as you give your body the right nutrition and reset the metabolism so it's got a chance to heal. I've had so many couples that wanted to fall pregnant, and we sorted their health out, both sides, but especially the female, and they were able to conceive. I'm not saying that this guarantees anything. Just they don't come to me to get pregnant and say, Dan, make me pregnant. It's like, I've done that twice before.
You're asking the wrong.
Right. No, but they just wanted to make a difference to their health. And surprisingly, it's really rewarding when that happens and they've got a baby on the way. People with autoimmune conditions. For example, I had one guy, 67 years old, and he has a very rare autoimmune disease called Schnitzler's syndrome. And Schnitzler's syndrome, there's like 300 diagnosed cases in the world. It's really, really rare. I think he's one of 2 people in Australia that's been diagnosed with this. Yeah, right. He took an injectable drug every day to keep it under control. If he doesn't take that drug within hours, he breaks out in urticaria, like hives, and then gets really achy joints, and it's exhausting for him, and it's really painful. And we had him on protocol. Yes, he lost weight. His aliveness, his vitality improved greatly. He toyed around with the medication, which kind of scared me a bit, but he didn't take his medication for a couple of occasions, and the symptoms didn't come about. Yeah, right. And then he got all his specialists, his pulmonary specialist, his heart specialist, his GP. They were all phenomenally impressed with the outcomes. All his inflammatory markers reduced. People with gut issues, particularly if they have certain sensitivities to food, I put them on the protocol for a certain period of time. And then when I move them back towards a more balanced whole foods, isocaloric diet, they start trialing those foods that previously triggered them, and they don't trigger them anymore. Yeah, right. So some things reset, like, you were doing intermittent fasting before. Yeah. You can get immune regenerative effects of fasting, and I seem to see the same or similar results, maybe even more powerfully, with the approach that we were taking. Yeah, right. What else? Longer term, that's not necessarily felt other than in your sleep, the improved sleep. And you notice that when you wake up more refreshed, but that's an indication of improved brain function. And if you remain overweight or obese for prolonged periods of time, the more your brain shrinks. Yeah. Like, people don't realize we used to get taught that you're born with a certain number of brain cells, neurons. By the age of 6, you've got about 100 billion neurons. And then our capacity to learn and integrate things over time as we get older is based on the number of connections between the neurons. So each neuron has hundreds to thousands of connections to other neurons. So there's literally more neuronal connections in your brain than there are molecules in the observable universe. Yeah, right. That's how expansive the capacity of our brains are. And then, but it's going to work optimally when you treat your body well. So, I spent some time working with Alzheimer's Australia, and here's what we know: what's good for the heart is also good for the brain. So you have to if you eat food and correct your metabolism to prevent heart disease, that's also having enormous benefits to brain health as
Yeah, right.
well. Yeah. So you
More,
don't want your
does
brain
it
to
benefit
shrink because,
does it benefit the brain more so than, you see a lot of things on apps and stuff like that for training your brain and keeping your brain active and all that sort of stuff? Would it benefit to that along the same
oh
sort
yeah,
of lines, or yeah?
absolutely. Yeah. I mean, you want to remain active.
Mm.
So otherwise you end up with metabolic dysfunction, heart disease, you'll have a stroke, or you get joint pain and then have osteoarthritis, and then you're no longer active, you're not participating in life.
Mm.
And it's that participation and in life and interacting with people, and that's what's most beneficial for brain health.
Yeah.
So you don't want to overdo the sugar and fat. um, you want to reduce inflammation as much as possible. I mean, if people just minimize, ideally cut out grains and dairy, if they brain fog, right, and they just can't think clearly and they're irritable all the time, then if you just do those two things, drink more water and cut out dairy and grains, it would make an enormous difference just to how you get through the day. And when you're irritable and you're tired and grumpy and you can't think, it impacts your relationships as well.
Oh, yeah,
So
sure.
your quality of your relationships and your life, which is dependent on the quality of your relationships, enormously degrades.
Mm.
So you want to keep all of that in mind.
Yeah, for sure. So one of the other things, lastly, I had was I had a few messages this week about, hey Trev, what's the secret? I put on a few kegs over, lockdown, because a lot of people are messaging me and musos as well. So they're, doing nothing now, basically.
Yeah.
And, I suppose the question is there a secret in the first place? And the other thing I get back after saying, either to call you or there isn't one, I'm just doing what you say, is, I'll go research it. There's more research for me to do. Why don't we just research ourselves into oblivion before actually doing anything to to impact our health?
Yeah. Yeah. It's an interesting one. So, we were talking before about, so everything's, the overarching context always has to be one of performance.
Mm.
So you want to handle your health so you can perform optimally. And I don't mean like just, I can perform in my day and I get stuff done and I fulfill on my work requirements, etc. No, is it optimal? And you want to get interested in how much further you can push your performance, and you want to perform at a high level. And so you've got to have things to be workable. If things aren't workable, you can't perform at a high level. And
Mm.
that workability is really a function of integrity.
Yeah.
And you got to do things the way that they're designed, and you got to do what's expected of you, even when you haven't explicitly said, because when you got to keep your promises and agreements, right? So if you don't do that, then things aren't workable, and then you can't perform at a high level. So the context is always performance.
And then
Now,
your experience of that as well, though, too. Yeah, even if you can perform at that level for so long, your experience of it is, I'm dying. This is killing me. I'm getting burnt out. Versus just
that's
being able
right.
to smash that out. Yeah.
Yeah, that's not optimal. It's not sustainable if you've
Mm.
got that experience.
Yeah.
And then it'll flip. So it's got to be, you got to hold a context, that this is not a short-term thing. This is like a real transformation for the rest of your life.
Mm.
This is where you get to finally handle it, grow up, and then discover what it takes to maintain that for the rest of your life. It's not just about losing. I mean, if you just want to lose 4 kilos, like take your shoes off, do a shit, get on the scales. It's not hard to lose 4 kilos. And people always say, oh, I just need to lose 5 kilos, or I just need to lose 10 kilos. They say those numbers because that's all they've ever been able to do in the past. And that's what occurs as possible to them. But if you speak to me, I'm looking at you, I'm like, dude, you need to lose 25, 30 kilos. But that doesn't occur as possible to them. So until they see a pathway, so as a coach, I've got to work with people so that it actually occurs as possible. And when it occurs as possible, they'll take actions consistent with that possibility and what they're committed to. But if it doesn't occur as possible, it's like they'll give it we'll try it out. And if people use that language with me, oh, I'd like to give it a try, I don't start them.
Yeah.
You know, it just becomes too, it's got to be enjoyable for me to coach people as well, right? So, but it's really like, it's the actions, and it's not about your thoughts, and it's not about your feelings, and it's not about your mental state, and it's not about your emotional state. So if I think I know enough, or if I feel I know enough, there's always I don't have the result that I want because some lack of resource. And in this case, it's lack of knowledge. So I'm going to research it. And it's like, you arrogant jerk. You've had all these decades to learn what you needed to learn to handle your health. And now you think you can just jump online and learn like everything that scientists have dedicated their lives to, and clinicians have dedicated their lives to learning about for over decades. And they're the ones that realize how little they know. And you think you're going to get online and pick out of the thousands of dietary approaches and weight loss solutions the one that's, no, here's what makes the difference. Pick one. Do it. If it's just about losing weight, then it's not hard. Just eat less, you know. But if you want to transform your health, your vitality, you want to reset your metabolism, you want to rebalance your hormones, you want to get rid of the brain fog, you want to do it in the most healthful way and learn how to sustain those results for the rest of your life, that's a different ballgame.
Yeah.
You know, that takes a certain level of commitment, and every result that you've ever accomplished in your life has always started first with a commitment. And people just don't commit because they don't trust themselves. They've sold out so many times. They've failed in the past. And now everyone wants to have a private transformation, a private, like, you know, I'm going to sort myself out and then go, ta-da, look at me, don't I look fabulous now? It doesn't work that way. You got to commit, and you got to be willing to go through the stuff that you haven't been willing to go through before.
Well, and that's why I jumped on, you know, that's why I spoke with you about doing it, because I've lost weight in the past before. You know, Lan said that to me the other day. She's, oh, you always just go up and down anyway. And I thought, yeah, but then that's why I'm talking to you about it, because I have done that before. It's, as you said, it's not hard actually losing the weight. You know, as you said, eat better and don't drink so much, keep doing my training. And over, you know, 6 months, a year, I think the last time when I was probably heavier than I was when I started this, you know, I started training with a mate and who's pretty fit anyway. And over probably 12 months, got down to, you know, really fit and healthy and running tough mudders and, you know, all that sort of stuff. And it was, I was fine. And then over the next 3 or 4 years, then started to gradually, and because it's gradual and you see yourself every day, you don't really notice it so much, you know, until I walk in, because, you know, Lan's family's Vietnamese. They don't hold back with that stuff, man. I walk in the restaurant after not seeing them for, a month or so, and I walk in, they go, wow, Trevor, you're fat. Thanks very much. You know, and I was there this morning and three of my sister-in-laws come over and said, oh, you're losing weight.
Wow.
You know, I don't even have to say anything. They spell it out anyway.
I mean, you're close to what, 10 kilos now, and that's in a month or something.
Yeah, 10 kilos in a month.
That's predictable. It's par for the course.
So,
you have to deal with the comments from your environment, and that's what I think a lot of people are afraid of, is making that declaration, and then in the public eye, even if only in their close circle, they fail. And the fear of failure is just, man, everyone deals with that. You know, everyone deals with the fear of failure, and it's immobilizing. you know, and it's, I mean, it's also ridiculous because you wouldn't have that fear of failure if you hadn't already failed before in the past. So you're just taking that past, which has got nothing to do with right now, and the future is as yet unwritten, right? But you're taking that piece of the past, you're projecting it into your future, and then it stresses you out right now in the present to the point where it immobilizes you and leaves you right now with the experience of already failing.
Yeah.
And if you can kind of get the absurdity of that and go, hang on a minute, future hasn't even happened yet. What am I worried about?
Yeah.
And I've never done this before. And then you give your word and you make it happen. I mean, it's, you know, it's really simple at the end of the day. It's just not so easy because you're human and you got your own humanity to deal with. But that's why coaches make such a difference, you know. So I recommend people get a coach and pick a program and just do it and learn along the way. Like, what is it that you're actually doing? Why is it that you're eating this way? What's the evidence for this approach? Is there clinical data that backs it up? You know, what is this something that doctors would recommend? You know, you've got to kind of do that critical thinking for yourself. And if you don't have the cranial capacity to do that, then you got to trust. You just got to trust and take the coaching and just go with it. But
the last
researching just doesn't. You can research for decades. It'll do nothing to your fat ass.
Like I said, a lot of the stuff we spoke about on these things, I ask and get answers for the people that, you know, are interested in what I'm doing and can get something out of that for themselves. But a lot of the stuff, you know, especially with the glucose binding to fat and all that sort of stuff, I've known that for years through, you know, back when I used to go to the gym 5 times a week and do all that sort of stuff. You know, I've always been interested in that sort of stuff. So I know a lot of it anyway. So
yeah. I know.
Last thing, because we don't want to keep it going too long. One of the comments I had on the last update, someone's clicked on your profile and recognised you as the wine doctor. And I can see you drinking wine there. Tell us a bit about that.
I'm a huge advocate of the Mediterranean diet. So all the clinical literature around, you know, the best diet for not just heart health but also brain health seems to converge a lot on the Mediterranean way of eating. There's no clearly defined Mediterranean diet. It's a sort of general way of eating, and but wine seems to be an important part of that. This wine, the Wine Doctor wine, it's inside of my commitment for longevity. So I'm committed to longevity and improving the health span, not just total life length, but how do you increase the total number of healthful years that you get to live? And, you know, don't smoke, maintain a healthy metabolism and weight. You know, if you look at centenarians, what's mostly common amongst all of them is they've never been fat. And not just centenarians. I mean, you go to Ikaria in Greece, for example, they've got the highest number of people, highest percentage of people in their 90s. And there's like almost no dementia, almost no cancer. And wine is a big part of their diet. So what is it about wine? It's the polyphenol antioxidants in the wine that get liberated from the grape skins during fermentation. Right. And those molecules, those antioxidant molecules, molecules that people may have heard of, like resveratrol, quercetin, fisetin, epicatechin, there's like a cocktail of 500 or more. Mm-hmm. And these molecules aren't so soluble in water. But during fermentation, when there's some ethanol present in the wine now, they are soluble in ethanol. So they get liberated from the grape skins into solution.
Right.
And in the context of wine, better than supplements, it absorbs through the lining of the mouth, through the buccal mucosa, a couple of hundred times more effectively than the gut, and straight into the bloodstream. And it's more bioavailable to our tissues. So the Wine Doctor wine, we've elevated the resveratrol concentration 100-fold. So in a normal wine where you would get 1 to 4 or 5 milligrams per liter of resveratrol, this stuff's got over 100 milligrams per liter. So I have 1 or 2 glasses of this a day with my evening meal. And, you know, so like I said, don't smoke, maintain a healthy weight, and don't be a jerk and harbor resentments, and daily consumption of moderate amounts of wine. Daily, because
that's why that's so great. Because in a normal bottle of red wine, like how much red wine would you have to drink to make any difference with that side of the thing, with the antioxidants?
Yeah, I mean, you'd have to drink wine daily for decades.
Yeah.
So we're saying those kind of health benefits, if you drink this stuff with the elevated resveratrol concentrations, you probably get it in months.
Yeah. Cool. And it's actually surprisingly nice. I remember when you first told me about it, I went, yeah, but does it taste nice? That's all I care about.
Everyone says that.
And
this is what longevity tastes like. There's longevity. That's what it tastes like.
The guy that said that on Facebook, I said, mate, I had it as my table wine at my wedding, so I wouldn't have had that if it wasn't good.
And just to clarify things, I'm not the wine doctor.
No, exactly.
The wine doctor is the label. The actual wine doctor is Dr. Phil Norrie, and he's an Australian-based GP, and he's also a medical and wine historian. And he's probably the most degree qualified general practitioner in the country. Yeah, right. And he's my medical director and colleague and inventor and patent holder, because it's patented. He's the sole author on that patent. Right. So yeah, he published a book recently called Wine and Health, and I got Professor Joseph Maroon from the US to co-author a chapter of that book as well. And Joe Maroon, he wrote the book called The Longevity Factor, and Joe he's a famous neurosurgeon in Pittsburgh, and he's the team neurosurgeon for the Pittsburgh Steelers. And he's also the senior vice president of the American Academy of Anti-Aging Medicine.
Yeah, wow.
So, you know, and he's a huge advocate of the wine.
Cool. I can't wait to be able to get it back on it.
Yeah, well, that's when we transition you out, then I encourage daily consumption of moderate amounts of wine. What's moderate? A bottle a day, shared between 2 people, with men having slightly more than women.
Cool.
You know, that would
Lan doesn't drink wine, so I'm going to have to take up the slack.
Sorry?
I said Lan doesn't drink wine, so I'm going to have to take up the slack.
Yeah, just be careful. You can't have too much.
All right, cool.
Then the alcohol becomes detrimental.
Yeah, exactly. All right, thanks for the talk. I'll see you again next Sunday. If you have any other questions, guys, just message me as you have been, and I'll get them sorted with Dean next week. We might actually even have a podcast coming up soon that we're going to run regularly. We'll keep you updated on that as well. And I'll update you on my latest weight and measurements towards the end of next week. Thanks for tuning in.